Welcome to the McTox Curriculum, brought to you in collaboration with Western University, the University of British Columbia, and McMaster University. This presentation is part of the McTox Curriculum built for residents and fellows from PGY 1 to 5. This topic is about hallucinogens. This presentation is brought to you by Waleed Al-Hazani. By the end of this 10-minute presentation, you will be able to 1. Define hallucinogens and describe their classifications. 2. Discuss the initial management of some hallucinogen exposure. 3. Recognize the effect of hallucinogens on patient competency. Hallucinogens are defined as chemicals that cause altered perception of existing things or creation of perception without external stimuli, with some preservation of sensorium. Hallucinogens can be from naturally occurring substances or synthetic formulations. A case. A 21-year-old male is brought to the hospital after attending a rave with his friends. During this event, he started to scream and behave strangely after taking a drug which was meant to keep him dancing all night long. His vital signs demonstrate a heart rate of 124, a blood pressure of 138/86, a respiratory rate of 24, and he is saturating at 98% on room air. His temperature is 37.7 degrees Celsius. He looks diaphoretic, agitated, and he is clearly hallucinating and scared. His blood work shows the following results. Note the mild elevation of AST and the hyponatremia. Ethanol, aspirin, and acetaminophen levels are normal. How are you going to approach and manage this patient? Hallucinations can develop after being exposed to either natural substances or synthetic products. Examples of naturally occurring hallucinogens are psilocybin and psilocin-containing mushrooms, like psilocybe. Ibotenic, contained in Amanita muscaria mushrooms, can cause hallucinations as well. Another example is bufotine, a hallucinogenic substance found in the bufo toad's venom gland. Muscalin is another such substance found in the cactus peyote buttons. Tetrahydrocannabinol, or THC, is the active substance in marijuana. Marijuana has been known and used for many years in multiple religious, cultural, and medicinal settings. A urine test for marijuana metabolites can be positive after a single use for days and weeks. Sylvia divinorum, from the mint family, can also be used to cause hallucinations if chewed or smoked. The other class of hallucinogens are the synthetic group. Every year, new compounds are engineered and re-engineered. Often there is a delay in the legal banning of these substances due to the speed by which they are produced. MDMA and other hallucinogenic amphetamines have some hallucinogenic and reality distortion effects in addition to the sympathomimetic toxidrome. LSD is the synthetic form of the hallucinogenic lysergamides found in some fungi and plants like morning glory. Ketamine is a known medicinal drug used in general anesthesia and for procedural sedation. Due to its dissociative effect, it has become used as a hallucinogen known as Special K on the streets. PCP is another dissociative synthetic drug similar in structure and effect to ketamine and was initially manufactured as a general anesthetic. Synthetic cannabinoids, also known as a legal high, have invaded the street in recent years. Manufacturers keep changing the chemical structures of these compounds in order to overcome legislation prohibiting their use. Most hallucinogen users do not present to hospital unless there are complications associated with the use of these substances or they are experiencing bad trips, triggering their friends to seek medical assistance on their behalf. Benzodiazepines are considered the mainstay treatment for these patients. It assists in calming down their overstimulated sympathetic nervous system. Benzodiazepines are also used to prevent potential complications like rhabdomyolysis and hyperthermia. External cooling should be applied as indicated for moderate to severe hyperthermia. Rhabdomyolysis can be treated with intravenous fluid and bicarbonate in order to prevent acute renal injury. Hyponatremia should be corrected according to the patient's clinical status. It should be noted that emesis is commonly associated with some hallucinogens like LSD and the various cannabinoids. Now let's return to the case. This patient must have taken one of the synthetic hallucinogens that can lead to a bad trip. Dancing and sweating all night while drinking alcohol and co-ingesting a hallucinogenic sympathomimetic drug can lead to acute hyponatremia and mild hyperthermia with possible rhabdomyolysis. Intravenous lorazepam or diazepam will help in sedating the patient and decrease their sympathomimetic overdrive. Intravenous fluid should be started with special attention to the rate of sodium correction. A CK level should be measured to check and monitor for any evidence of rhabdomyolysis. In the meantime, it is critical that infectious and metabolic causes of the patient's presentation be sought and ruled out. After treating the patient with a benzodiazepine and administering intravenous fluid, their general condition improved. His CK level was mildly elevated, and you decide to continue with serial levels and to also monitor their sodium. During the evening, he asks to be released home, promising that he would drink water for rehydration. After talking to him and explaining his medical condition as well as your concerns, he seems to understand what you told him and appreciate the consequences of going home against medical advice. This concludes this presentation on hallucinogens. Please ponder the following questions. 1. What would you tell the patient about his condition? 2. Would you let him leave against medical advice? Why or why not?